Hi, I'm Meshal Malik, and you're watching Indus Special. The health ministry in Afghanistan has raised the alarm after random coronavirus tests in Kabul led to the belief that the rate of infection might be much higher than actually thought or reported. With the pandemic causing countries to face unprecedented challenges, how is the situation playing out in Afghanistan, a country still reeling from conflict and economic turmoil? Joining us for this discussion today is Dr. Wais, who's a medical expert and also a member of the Afghan Medical Council. He joins us from Kabul. Also joining us today is Mr. Rahim Sarwan, who's a journalist, joining us also from Kabul. Thank you both for joining us today and welcome to this show. Dr. Kharooti, I'd like to begin with you. Now, how is the medical community taking the statement which has been released by the health ministry saying that out of 500 random tests that were carried out, almost 1/3 were positive?
Yeah, it's alarming. And we were anticipating long before, but now it is practical and it is very visible now that what is the scale of the problem in Afghanistan. And I'm not surprised, by the way.
Right. You're saying you're not surprised. Why is that so? I feel like the numbers were already high. As you being a medical professional, were you hearing from the medical community anecdotal incidents of individuals coming with those symptoms but just not being tested? Why is that that not being surprised?
Well, I have to add something that we have the mortality rate is not that high, as I'm in constant contact with the hospitals, with the doctors. We have the mortality rate is not that high, and infection or infecting is something different than going actually through the actual disease and the severity of the disease and the different stages that disease have. So I guess we had very few cases that went to the critical stage or went to the severe stage. So that is in coming days, we can be very clear about that,
right.
That what this country is going through,
right.
in case,
right.
case of corona.
Right, doctors, stay with me on that. I'm going to come back to it and talk about what it means when randomized tests show that there's a high proportion of positive individuals. And if this has led to community spread, what will that mean for the hospitals? But before that, I want to jump to Mr. Sarwan and talk to him a little about the government's policies, their game plan that has been when it comes to trying to control the outbreak. What so far has been the major development and what so far has been the basic guidelines given by the government?
Well, actually, government just locked down the major cities and government just gave us figures day by day. And past almost 3-4 days, we had 600 new cases. Just in past 24 hours, we had 190 new cases in Afghanistan, 5 dead among that. And the total number just reached to 2,894. And we had the dead, almost 90 people dead from coronavirus so far in Afghanistan. And the number, it seems like day by day increase. And we had more coronavirus infected people in Afghanistan. So the government just tried to lock down, and we have no lockdown in our cities. In Kabul, you clearly see people on streets. They are just coming out and nobody care about the lockdown. And government are busy with the figures and collecting samples, and they give us the figures. So far, there is no concrete measures to control the coronavirus. And this virus came from Iran. And in the beginning, people had a lot of complaints and call on government to block the border, and government didn't. And that's why we had this pandemic. And it seems like we will have next 2 months or next 3 weeks, it will be a really bad situation in Afghanistan.
Right. Mr. Sarwan, since the case was identified and detected since the 24th of February, and now we have entered May. Since then, how do you see and perceive the attitude of the authorities in Afghanistan? Would you say that throughout the lockdown has been as lax as you're saying it is right now?
Well, government tries to have alternative like A, B plans for that. But as far as the government, they didn't implement the lockdown completely. And that's why we have more numbers. People are not cooperated. At the beginning of the lockdown, it's 1 month that we are in lockdown. At the beginning, people were care and police were everywhere in the cities and they stopped people from moving. And nowadays, since Ramadan is, we have Ramadan, nobody cared the lockdown. People are coming out and we have huge number of poor people. Those people that they are under the poverty and they have no jobs. And when you tell them that stay home, they have nothing to feed their family and they're coming out. Beggars are in the cities. So that's get the situation worsened. Government tried and recent approach and Kabul and other major cities, government tried to distribute bread among people, among poor people. That's not work as well so far. It's in the beginning and the first stage. Let's see that will implement that. But what we heard from the Public Health Ministry and off the record meetings with them, they tell us that the situation is worse than they are reporting.
Right. Off the record statements, of course, being floated around during this time. Dr. Kharooti, on that very point, that the lockdown isn't as stringent as it needs to be. You earlier mentioned that the mortality rate isn't that high, but as we just talked to Mr. Sarwan, he told us that 190 cases have been reported so far, and it seems like the numbers are rising. What do you see as the worst case scenario given the health infrastructure in Afghanistan?
That is the one case that from where a journalist is looking from. And the second is where is a consultant or a professional is looking from. I said we have confirmed cases, and these cases, I said in my earlier statement that I'm not surprised. Mm-hmm. The cases will be high. The number of the cases will be very much high. That's a different topic. But what is that we are getting from our colleagues in hospitals? The mortality rate is showing less. One is about confirmed cases, and one is about the actual disease cases. Like we have asymptomatic cases, right. We have other cases, static weight. So we have different type of cases. So now Afghanistan, we are not clear, but we should be vigilant and we should take steps much earlier, which was delayed, and we should come on one page, and we should be having a committee, a special medical committee, which should be responsible. The committee should be responsible to deal with the technical sides of the disease. So I'm in much in the favor of technicality, not in the favor of politics, in the favor of economic burden that they have on the people, because these are the side effects of the disease, not if you don't cure the disease, the side effect will remain.
Right. As you're mentioning that there needs to be a greater understanding of the on-ground situation by bringing in the medical experts into the conversation. How do you feel so far the medical voices within Afghanistan have been taken, especially throughout this pandemic? Now, we're seeing all across the world, there is a difference of opinion between governments and the medical community. But talking about how there is a lot of political turmoil in Afghanistan, war-torn areas, still attacks and violence being carried out. Do you feel like the medical community is being even more sidelined than in other parts of the world?
No, it is not sidelined, and we are not just trying to blame game. So we are just here for cooperation with the authorities, and we are working with authorities, and I hope we will come soon with a very good news to have a complete, a comprehensive approach to the crisis. And one of that was that we individually in Afghanistan, it was in Afghanistan based, that we started the telemedicine in just 3 or 4 days in the previous Tuesday. So that was a big step. We connected hospitals, connected different areas of Afghanistan to the capital, from the capital to the United States, to UK, to the Middle East. So we are working.
Right.
We should not be the people who to put blame on someone. If someone has some capacity, should come forward and put his proposal, and we can work on that.
Right. No, it's still during this time that the politics is set aside and there's greater transparency. There is a need and there's an urgency for everyone to cooperate. Mr. Sarwan, on that point, where do you feel like the main roadblock is during the process of trying to create, as Dr. Kharooti himself stated, that he's looking forward to a comprehensive plan coming forward, but it still hasn't as of yet. What do you feel is the main roadblock preventing that from coming forth and making that happen?
Well, this is the crisis which never we had the history of that. So in other parts of the world, nobody yet, even United States, they had problem with that. What about Afghanistan? That we have less medical facilities or not adequate medical facilities. The government trying, our doctors, medical staff, they really fight against this pandemic. We had more than 250 confirmed cases are from the medical staff. We had many doctors, we lost them because of the coronavirus, COVID-19. So public health is, ministry are doing their job, but this is more to the people, that people cooperate with the medical or the public health ministry. In Afghanistan, I said before, at the beginning of lockdown, people were really cooperate, but right now we see there is less cooperation from the people. And we just have 779 confirmed cases in Kabul. So, and Kabul is like almost with 5 million population. It means that the things will get worse, and what will be the next steps? How to stop this spread is the only thing that the experiment had in other countries is the lockdown.
Right. So, sorry, Mr. Sarwan, to interject here, but given this new statement that is creating a lot of waves, given by the health ministry itself, that they fear that the spread is probably much higher than they anticipated it. How do you think this will change events from here now onwards?
Well, from now, the number will be decreased. We will have next 2 months, like Deputy Minister of Public Health said in his conference, that we will have a dark days ahead of us. So, I mean, we will have huge numbers until the lockdown is not completely implemented.
Right. Dr. Kharooti, now the main components of trying to tackle this virus that the world acknowledges is test, treat, and trace. How is Afghanistan handling all those three components? We know that in a population of almost 38 million, only 12,000 or so tests have been carried out so far. What are the plans to expand testing networks, to expand tracing networks?
Yeah, there are two things medically. That on one side, we increased the number of testing. On the other side, there is the case definition, but England is right now working on it. So we are using a term, treat patient, not PCR. So PCR can be false positive or can be false negative. So what are the symptoms in a patient? we should go for that. We should go to treat a patient unless otherwise proven otherwise of some disease, having some other disease. But stressing on this in a restrained, with limited sources country, stressing on increasing the tests, the number of tests, I think will not change the outcome. The outcome will be changed if you diagnose early and act early. That will change the game. And yes, we, with all of the policies or with all of the actions that our government and public Ministry of Public Health has taken so far, we want speedy action.
Right.
We want this bureaucratic tapes to be on. So we want speedy actions. We want to move it forward and make it faster.
Dr. Kharooti, you mentioned here that you feel like greater testing won't change the outcome. Exactly what do you mean by this? Because this is perhaps the greatest step, the most needed step, which has been recognized all across the board for identifying cases, since we know a huge number of them are asymptomatic as well. So it's a needed step to curtail the spread. What do you exactly mean it won't change the outcome?
This is very simple. Like you, for example, if someone is positive, then what kind of diseases he has? He has moderate, or he is severe, or he is critical. So maybe there is someone who has critical disease. So the result of the test will come, the PCR result will come late. So treat it. So treat the patient. That's what I meant from
right.
That we should not treat PCR results, we should treat patients.
Right.
That's what is happening in UK, a country with much more facilities that they have, the economy, the big economy they have, the big NHS they have. So in Afghanistan, like in Pakistan and other countries, we have to change our strategies according to our resources, in accordance to our resources, not copying someone else. That's right. What I mean by that.
Right. Definitely, and that's an important point. It can be stressed on enough that according to the context of each and every country, strategies need to be adjusted because every country has varying facilities, and especially when we talk about Afghanistan. On that point, Mr. Sarwan, just want to talk about the state of facilities right now, talking about the PPEs that are present in the country, the state of the hospitals, and what are the major hospitals taking in COVID-19 patients? How much support is there really for trying to tackle this disease on that front?
Well, there are complaints and there are some government sayings that we had only one big hospital in Kabul that called Afghan Japan. That's the hospital with more allocated beds for the COVID-19 diseases, and as well the government tried to have another hospital in Herat, which is the second. We have more confirmed cases in Herat as well, and they built more small hospitals in some districts, like in Kabul, in Surubi district, which is one of the districts that there are reports that many people died from the coronavirus. But what the public health ministry say that if they have more kits, they have more facilities to provide for the COVID-19 patients, but people still are complaining. We had many complaints from the Afghan Japan hospital that they say that there are less medical equipments are there to those people are coming there and they should be tested. So, I mean, this is like a crisis.
Right.
No one's people are really and
right.
worry about that.
Right, definitely. Crisis, no one was prepared for it, and now governments all over the world are scrambling. Thank you so much for helping us understand the on-ground situation in Afghanistan at this moment. Mr. Rahim, Sarwan, and Dr. Kharooti, thank you for joining us from Kabul. We're going to go for a short break. When we return, we discuss food security in South Asia. Stay with us. Welcome back to the show. Now, according to a report released by the United Nations in 2019, undernourishment impacts almost 15% of Southern Asia, signifying food insecurity as a great challenge. Now, with the coronavirus disrupting supply chains and production, how will food security be further impacted in the region? Let's find out more. Joining us for this discussion is Mr. Chandra Bhushan, who's an environmentalist and an advocate for sustainable development. He is also the CEO of iForest, which stands for International Forum for Environment, Sustainability and Technology. He joins us from New Delhi. Also joining us today is Mr. Abdul Latif Khan, who's a disaster management specialist and also associated with the Institute of Disaster Management and Vulnerability Studies at the Dhaka University. He joins us from Dhaka. Thank you both for joining us and welcome to the show. Mr. Khan, I'd like to begin with you. Now, when we talk about food insecurity, especially in South Asia, how is this expected to play out, especially in a place like Bangladesh, which already has 25% of the population suffering from food insecurity?
We don't have the history in Bangladesh, but in the undivided Bengal or undivided India, there was the history of the pandemic. But in Bangladesh, we have the history of the food insecurity after we have 1973 and 74, consecutively 2 years flood, and that's really have no food grain that really produced in the country, and that have an impact into our total food security. Now, this coronavirus situation also had an impact, but however, I think that Bangladesh is very lucky in this situation. We are, when the coronavirus we have started infected first person in March, that is the time that when we are really going to harvest our rice. And this is the biggest rice, the 80% of the total rice production in the country. That started, but the time was also the lockdown, so people are not moving from one place to another place. And the highest this rice, which were produced in northwest parts of the country, northeast parts of the country. So the people from the other parts will go there. But however, as there were the lockdown, so the people were not allowed to go. However, the government and some voluntary organization, they took the initiative and they really transported the labors as well as the machineries, and the harvesting is now in a full swing. So this harvesting is, we have a bumper crop this year. Last year the government had taken for warehousing 400 ton rice. This year, because of questioning of the food crisis after the pandemic, the government has increased that to 800,000 metric ton, and we are moving on that. So I hope that in terms of the food prices, we are in a much better situation.
Right. Mr. Abdul Khan, just picking up on that point you're talking about, that there being a bumper crop and Bangladesh, fortunately, being in a good position, being in a strong position to make sure that they don't run out of food supply. How is the distribution working at a time like this? Because that too is crucial, ensuring that there aren't unfair price hikes and making sure that the most vulnerable populations get their due share, and especially that the bumper crop doesn't go to waste.
It is always a problem even when we are talking in the peacetime, there is a bigger question, availability versus the accessibility. However, during this coronavirus, the government had took a good decision, and they are identified we have around 500,000 people under the social safety net program, and they have database, but there are some other families who are really needy, but they are not under the social safety net program. So they identified by the local representative, local administration, and they included into that database. And then the administration, and then, as I said, the national and the local NGOs, the political wings of the different parties, they are in coordination at the local level, providing the 15 days food to everyone else.
Right.
However, as I say, the bumper crop, we are keeping, we still have a lot of the food grain in our godown. So this 800,000 metric ton is for next 2 years. We are keeping in our godown.
Right. Mr. Khan, stay with me. I'm going to jump to Chandra here. Chandra, now India has one of the biggest lockdowns in the world right now. How is that impacting the labor responsible for transporting food, for harvesting food, the farmers on the ground? How is this massive lockdown preventing them, and how are government facilities helping them?
I think one of the initial steps that government took was to not lock down villages as far as harvesting of crops was concerned. As you know, this is the end of the Rabi season, and the corona has struck right at the time of harvesting. So harvesting was allowed to go on as usual. So was procurement, because government is also one of the major procurer of food grain. So procurement also happened. But of course, because of restrictions and certain problem in interstate movement of transport, there were problems. Now, coming back, I think one of the fundamental issue we have to understand is that South Asia might not face the scarcity of food grain. But what Corona has done is it has reduced the income of the most poor and the most vulnerable. And that means that their access to nutritious food. See, we have access to basic subsistence food. That is the minimum. And I'm sure the governments of South Asia will be able to provide to everyone. In India right now, large-scale food distribution is happening to urban migrants and to people who are stranded at different places. So those are basic subsistence allowance that is being given. But Corona will have impact on the income of the poorest of the poor. And I'm afraid that South Asia, the entire South Asia, including India, we will see enhancement in poverty because of coronavirus.
I'm glad you bring out the migrant workers here. We're seeing imagery all across news channels, horrid imagery of how these migrants are trying to go back home during these conditions, and almost 40 million of them. What more can you tell us about that state of affairs? What is being done to support them, especially when it comes to food supply?
I think government and NGOs have actually done very well as far as providing food is concerned. Every state has started a free food distribution program. And it started with Kerala, where significant amount of food and basic necessities were provided to the poor, and actually in Kerala to every household. And the same thing has happened across the country. So far, so good as far as the provision of food and basic amenities are concerned. We are able to provide that. NGOs have also come up and they are doing it. The issue right now for us and
but Chandra, sorry to interject here. It seems like out of the total 40 million, only 2.2 million are being covered when it comes to food supply, actual giving of food. The rest still remain vulnerable.
Well, I do not agree with that number, because what number you see is it doesn't cover large number of NGOs and social groups who have got involved in food distribution system. So I live in Delhi, and I do see Delhi has one of the largest urban migrant population, and there has not been any instance where people have not been provided food commodities by government or by non-government. So I think we have to look at it in the totality. In fact, I will go on to say that the performance of governments in the entire South Asia, no one expected South Asia to tackle coronavirus as it has done. I think we need to give credit to the government in terms of how we have handled this crisis, where a number of Western countries have failed. So I think there is credit due. We must recognize what is due and also recognize what is the problem. The problem is we have done well for 40 days. The question is how far can we go? I think that is going to be the big question in front of all of us.
Right. Mr. Khan, as we talk about this, how far countries still go in the conditions they're trotting along in? Given that this lockdown, given that this pandemic doesn't seem like it's going to be over anytime soon, how much more spending can governments do? When we talk about disaster management, risk management, what is the long-term game plan, especially when we look at the case of Bangladesh?
It is very difficult to put a line between the life and the livelihood, and where we will go. We cannot lose the life, even we cannot live without the livelihood. So keeping on those things, discussion with the epidemiologists, scientists, and the virologists, looking on the international trend of the COVID ups and downs. We are now we were still on the lockdown, and this lockdown will go till the 15th of the next month. But we are really opening slowly the economical aspects of the things. For an example, we opened the garments factories, which is one of the biggest economical issue for Bangladesh. However, there are some conditions that you have to maintain the health issues, and there are monitoring by the health department and the BGME.
Almost, Mr. Khan, almost 1,000 factories were opened in the past week and along then. How are these policies being implemented on such a large scale, these strict guidelines? We have heard about the conditions of these factories. There doesn't seem much room for social distancing. How is that these factories, that these places are operational while still maintaining the workers' health? The committee that they have moved to the different factories, the result they come out yesterday, they said that around 60 to 65% factories are doing really good inside the factory, maintaining the social distance and everything else. The rest of the factories are not as good as they are wanted, but they are trying to go there. But Mr. Khan, with the virus this contagious, if even 40 to 35% of the factories are slipping up, this could be disastrous for the entire country.
But there are another problem. The problem that is when they are coming to the industry, and then when they are going out to the industry and coming back to the industry again. In between the time, Bangladesh is a highly densely populated country, and where they are staying, because they don't have any dormitory or others, they are staying into a very, rented house.
Right.
3-4 people in a one room, and it is very difficult to really maintain the social distance or physical distance.
Right. Mr. Khan, that is a very important point to remember, that these workers aren't just vulnerable within the factories, but also when they move out of the factories, not knowing if they have been infected or not, they're carrying that to homes in which there isn't the privilege or the luxury of social distancing. Chandra, going back a little and talking about food security. Now, coronavirus isn't the only issue that is impacting South Asian countries this time around. It's the locust issue as well. The United Nations Food and Agricultural Organization says that India is facing the worst of its kind since 26 years. What more can you tell us about that and how that will impact food security in the country?
So the locust attack is largely affecting the western part of India. Rajasthan was at one point of time very, very badly affected by locust. And in fact, there was a massive air spray of pesticide that happened for this. We have not yet estimated what is going to be the overall impact of this locust attack on food. Fortunately, it has not hit Punjab, the largest and the most intensive agriculture part of the country. So we are still to estimate, but the initial estimate is that 2019, like Bangladesh, the total grain production in India has been one of the highest in the recent years. So the quantity of grain and the quantity of food production doesn't seem to be a problem, Meshal, right now. But I think the major problem that will happen is that the whole of South Asia will go into recession. I think it's important to understand that even if we start opening now, we are in for a global recession, and we are also in for recession or at least very low growth in our part of the world. And our part of the world is also very poor. So it will have a significant impact on the livelihood of people.
Right, Chandra, that is a very important point, and we're going to end the show on that this isn't the only long-term implication of what's going to happen after the coronavirus, but it is, of course, the economic implications of what is happening now and what will manifest later in the coming months and the coming years. Thank you so much, Chandra Bhushan, for joining us, Mr. Abdul Latif Khan for joining us. Thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye and take care.